what is hemostasis? Tell me all the steps in hemostasis. Blood vessel, damaged collagen fibers. Okay, collagen fibers exposed, right? Then 1 milligram factor, platelets attached by 1B receptor, then platelets will release thromboxane A2, then ADP or serotonin. Serotonin will cause vasoconstriction, and now there will be a platelet aggregation. Aggregated platelets will make primary platelet plug. This is also called as primary hemostasis. Okay, primary hemostasis. Then this will platelets will be activated. Activated platelets will convert fibrinogen to fibrin, and fibrin will be clotted. This is it, right? And I said a few more things. The in vitro equivalent 1 milligram factor. 1 milligram factor. In vitro equivalent is desmopressin. Do you remember? Desmopressin. DDAVP. They will say this is the tablet or drug. Okay. If a patient has a prolonged bleeding time due to 1 milligram factor disease, so we need a substance equivalent to 1 milligram factor. Then we will add desmopressin. Desmopressin will act as a 1 milligram factor. Okay. Then the in vitro drug equivalent to thromboxane A2 will be ristocetin. Ristocetin. Ristocetin is a tablet that will enhance the aggregation of platelets. That will work just like a thromboxane A2. Okay. So ristocetin and desmopressin can be stated as a triggers to understand the hemostasis. Okay. We can use this as a reagents, we can say. Okay. Yeah. This is clear. Then we also have one more issue. This clotted or this clot within a blood vessel is called as, so blood cells fibrin clots. So if these clots present within a blood vessel, they are called as thrombus. Thrombus, right? Thrombus has a problem. This thrombus will cause some issues. I will tell the issue names. If this thrombus present inside the internal veins, deep veins, such condition is called as deep venous thrombus. Okay, deep venous thrombus. Okay, that means internally the veins are blocked by thrombus. One famous or simple example will be in case of adults, formation of thrombus is high among adults. Okay, so have you seen varicose veins? Do you know what is varicose veins means? Ideally they are not good. In the backside of foot, here you will see veins, bulged veins. One of the reason will be DVT, but not all the time. Okay. Anyway, deep venous thrombosis. This is one problem. And this thrombus, what else it can do? If this thrombus present in the multiple arteries, multiple blood vessels, then that condition is called as disseminated intravascular coagulation. Disseminated intravascular coagulation, very dangerous condition. Almost all blood vessels in the body will be blocked by this one, right? With thrombus or clots. Then another issue is thrombus will lead to myocardial infarction. If this thrombus blocking the coronary arteries of the heart, that leads to MI, myocardial infarction or ischemic heart attack. Okay, blockage of blood vessel and stopping of flow of blood has been stopped to the respective organ. That is called as ischemia. Ischemia means blockage of blood flow to any organ is called as ischemia. Ischemia is not at all good. Okay, ischemia leads to tissue oxygen deprivation. Tissue oxygen deprivation leads to bacterial growth and further tissue death. Okay, so yes, that's why in order to prevent thrombus formation, in order to prevent the clotted blood entering into the blood, we have another mechanism called as fibrinolytic mechanism. Fibrinolytic mechanism. What is the function of fibrinolytic mechanism? This will remove the clots from the circulation. Got it? Remove the clots from the circulation. Now there is a problem with fibrinolytic mechanism. Say for example, fibrinolytic mechanism has a scissor molecule we can say, I don't know how to draw a scissor now. Yeah. So this is a plasmid. Plasminogen. So plasminogen will be converted to plasmid. Plasmid will cut the fibrins. Plasmid will cut the fibrins. But plasmid should be formed after the clotting, not before clotting. Got my point? This plasmid should be formed after the clotting process, not before the clotting. What happens when this is present before the clotting? Blood won't even clot. Got my point? If plasmid there in the blood, during bleeding time, if plasmid is present, it won't allow blood to clot. That's why plasmid should come into the scenario after clot. Plasmid should be here. It should not be here. Okay. So that you keep in mind. I will discuss plasmid again later. Then other important thing is, this fibrin, when this plasmid cutted the fibrin has been made into small pieces. Those small pieces of fibrin will be two types. Fibrin degraded products, FDPs, fibrin degraded products, and other one, there will be small particles of fibrin. They are called as D-dimers. D-dimers and fibrin degraded products are the result of fibrinolysis initiated by plasmid. Got it? Clear. Now let us see. In normal circumstances, in a healthy individual, when you got a cut and it's clotted and we removed it. When we are removing, we know we should get around 20 D-dimers and 20 FDPs in the circulation. That is the accepted products in the circulation. Got it? Let me tell you one interesting thing. When I did the D-dimer test, in D-dimer I got 80 D-dimers and 80 FDPs. What does it indicate? Why I got heavy fibrin degraded products and D-dimers in my test? What's going on in the patient body? Why I got elevated levels of these two? There might be excessive declotting process in the body, fibrinolytic mechanism in the body. As Shubhir said, when there is excessive declotting, that means there is excessive clotting also. Somewhere there is a huge clotting going on inside the body and we don't know. But there is a clotting, that's why we got many declotted products. Got my point? There is an excessive clotting in the body. Excessive clotting in body, and body was trying to eliminate them, plasmid degrading them. That's why we are seeing excessive declotted products. Presence of excessive declotted products indicates a increased clotting process in the body. Why this is happening? Why there is an excessive clotting in the body? That investigation we should do. When we are not doing this investigation, the complications of this clotting will be thrombus. Patient will die due to deep venous thrombosis, ischemic heart attack, DIC, disseminated intravascular coagulation. So, in order to detect DIC condition in the body, check D-dimer and FDP levels in the body. To check any thrombus issues, to check any deep venous thrombosis, we will do a lab test called D-dimer assay. D-dimer test will check the amount of clotting in the body by indirectly measuring the declotted products. Is it clear? When you are following regular classes, you can understand this concept. Any doubts so far? Yes, Diksha, Avinash, Multazim, Shubham?
So these two are the product of?
These two are products of, degraded products of fibrin. Degraded products of fibrin. When fibrin was made into pieces, those pieces are FDPs and D-dimers. Why there is more pieces of fibrins? That means there is an excessive fibrin generation in the body. There is excessive clotting in the body.
And so
why there is excessive clotting? That we need to investigate. Why there is excessive clotting? We need to check. Maybe patient has some viral attack or some other issues with the hemostatic mechanism. Maybe platelets are activating, platelets are self-activating. We don't know the reason, but platelets are activating and they are clotting the blood. Why the hell platelets are activating? Why platelets are releasing thromboxane A2 when there is no issue? When there is no cut of blood vessel, why the platelets are activating?
Is this related to that thrombocyte problem?
That we'll see. Maybe there are some thrombocyte issues, maybe there are some viral issues, or there are some genetic causes. We don't know. That we need to investigate. So that we'll see later. Yes, Mr. Keith.
Sir, I want to ask, is it possible to have normal protein and then higher plasmin level? We give higher FTP and DPM.
See, normal plasmin should be 20. And what is your first?
I'm saying normal protein
mechanism? Yes.
But then we have higher plasmin level. Is it possible to give a higher number of FTP and DPM?
Okay, very good. Keith is saying that, so there is a normal clotting, but there is an excessive plasmin generation, and this plasmin leading to excessive FTPs, leading to an abnormal false results. That might be possible. That is his question. That's why we will check plasmin levels with ongoing thing by cross-verifying INR, PT, APTT levels will be cross-verified with INR, International Normalized Ratio. For each and every patient, their clotting ranges are different. That will be standardized by INR. Do you remember? So, I will get INR calculation. According to INR, if my plasmin is normal, then these values will be normal. So, I will plot a standard deviation among plasmin levels with my FDP levels. When they are not correlating, when my plasmin levels not correlating with my FDPs, that indicates there is a problem in the body. Maybe there is a DVT, deep venous thrombosis or DIC ongoing in the body. Okay? So, fine. So, by this story we understood why there is an excessive clotting. So, let us investigate the issues. One of the reasons of excessive clotting is maybe the patient blood vessels are not so rigid. Patient blood vessels become very thin. Okay? And these blood vessels are damaging for a simple reasons. Maybe mechanical injuries. Okay? You have tapped them on the skin and their blood vessel ruptured. They released collagen exposed and blood clotted. This condition is called as, if blood vessel has an issue leading to a clotting condition, this is called as a rare genetic disorder. I will show here. Why this is not changing? Hereditary hemorrhagic telangiectasia. Okay, telangiectasia. So this is a blood vessel disorder. Classically, this is also called as Osler-Weber-Rendu disease. Okay, Osler-Weber-Rendu disease. This is an abnormal thrombus condition happened because of blood vessel issue. The blood vessel wall got issue, wall ruptured wall released collagen, collagen activated the platelets leading to some thrombus condition in the body. Okay, so this is a issue of blood vessels. Blood vessel problem leading to abnormal results, maybe excessive clotting or bleeding in the body. Okay, initially we are investigating only with bleeding and clotting disorders, but now we are seeing some other issues of this hemostasis mechanism, such as FDPs and abnormal clots. Okay, fine. So just keep in mind, this is a blood vessel problem leading to a thrombus issue. There is one question from this topic actually. So this is called Rendu-Osler-Weber syndrome. In this, the patients will have an abnormal capillaries on the mucous membranes. So there will be a twisted blood vessels can be seen among the mucous membranes of the patient. Okay. So blood vessels will be clearly seen on the surface of the mucous membranes. That is one symptom of Rendu-Osler-Weber syndrome. Yes.
Those things are
Both are same. Hereditary telangiectasia is the medical term, whereas the disease is called as Osler-Weber-Rendu disease. Both are same. Like hemophilia and Cooley's anemia. Got it? They are same. Okay. So now you have understood the blood vessels issues, this one. Then other things you need to understand will be our classical problems. Yes, clotting factor issues, right? So clotting mechanism you should understand. Tell me the clotting mechanism, our mnemonic 10, 11, 9, 10, 2, 1. Then here 7. So this is vitamin K dependent. And this is an intrinsic pathway, this is extrinsic pathway, and extrinsic pathway will be detected by prothrombin time, whereas intrinsic pathway by acute partial thromboplastin time. Common pathway will be detected by thrombin time, and the overall efficiency will be detected by thrombin generation test. Right? Write down the normal values of these. Yes. Yes. TT for common pathway.
Vitamin K dependent protein factors.
Vitamin K dependent 7, 9, 10 to 1.
7 or 9 please.
Huh?
7 and 9.
7, 9 not there. They are there. Check. Where you cross verified? It is there. It is there. I'm not sure about 9, but 7, 10 to 1 are vitamin K dependent. Last time I discussed. Yes, that is common pathway, right? Conversion of fibrinogen to fibrin. Fibrinogen and fibrin is there in common pathway. Yes. Okay. Clear? Yes. 7 is there in vitamin K. 7 is a vitamin K dependent. Yes. 9 also there, right? In the K dependent. Yes. Fine. This you understood. There are other important things. 7, 9, 10 to 1, but I'm not sure 9. You need to cross verify, but 7, 10 to 1 are vitamin K dependent clotting factors. 9 also there. Extrinsic pathway will be 7, 9 to 1. Oh. 9 is there, okay. Anyway. Fine. 9 is there. Alright class, Anshika, what are you doing there? Enough. Alright, then other things. What are the platelet properties? Platelet properties. Adhesion, aggregation and activation. These are the platelet properties. Alright, then what else we need? The ground things. Types of hemophilia. Hemophilia A, B and C. A is due to absence of clotting factor 8, then 9 and C 11. Right? Say for example, very good. Now everyone becomes scientists or what? I appreciate discussions, but it should be a topic related discussion. Anyway, if we have a hemophilia patient, what lab test you will opt? What lab test you will opt to identify hemophilia in a patient? Very good. What test? APTT. What is the reason? Why you opted APTT for hemophilia? Hemophilia is a clotting factors, they are present in the intrinsic pathway. Intrinsic pathway issues will be detected by? Yes, Miss Geeta wants come here, Geeta. Come here, please. Fast, come here. Please. Once come here. Please stand here. Yes, come here. Stand here, Geeta. Yes. Please, 1 second, students. Yes. Keep. You see down. You check your foot. See your foot. See, we can easily spot Keith, right? That he is not paying our attention. And Can you see all the students' eyes? See everyone staring at you. See them. All your classmates. You can see each and every one eyes, right? Just by seeing their eyes, we can say whether they are cheating or they are, actively listening to us. And Muskan, you talk with Piyush once. You talk something, you say. See now Muskan is smiling there. It's looking awkward, right? That's what happening to me when you are smiling there, giggling there. When I'm asking what is hemophilia, when you are smiling there, I'm feeling very awkward, Geeta. You can't able to understand this perspective. You are seeing only Vamsi sir from there. He's shouting something, he's telling something. See, you can see each and every one's eyes. You can directly stare at their, emotions. You sit in the last bench here, go last. Getting, agony. You know what is meaning of agony? From angry from heart. Where am I? Yes. Yeah, hemophilia test. Yes, Shubham? Yes, anyway, these are intrinsic factor issues. We will perform APTT. If APTT prolonged and PT is normal, that indicates a hemophilia. A possible hemophilia, then we will go for other tests, right? Directly we will go for detection of these clotting factor issues, levels of clotting factors. Very good. So, what will be the approach of each and every test in hematology? First, we will perform CBC to check the normal blood vessel values. Then, what else? In CBC, we are getting TRBC, TWBC, platelets. We are getting hemoglobin, indices. Simply indices: MCV, MCH, MCHC, RI, RDW. Then color index. Okay. Sorry, this is color index. Sorry. Yes. What else you will perform? PBS. Very good. You will perform peripheral blood smear. And what else you will perform? Very good. Bleeding time, clotting time.
Solubility test.
So solubility test will be okay. Okay. Solubility test. Then. Okay, TIBC, fine. Any more? Else? RI with reticulocyte count. Platelet count. Okay, reticulocyte count, ESR, we are performing, PCV, we are performing to get indices values. Then, if all these values are normal, still there is a problem in the body, we will go for further investigations, like not PCR. Okay, PCR, what is the purpose of PCR? For genetic assays, right? Molecular test and PCR. Under PCR, when you identify some protein issues, then you will go for electrophoresis for protein issues. Then what else we can perform? Platelet function tests. Platelet function test we need to perform. And else? That's it. There is one more INR test. Coagulation profile test. Coagulation profile test. PT, APTT, TGT, TT, right? Fine. So now you understood this one. Then other important thing, when you are writing an answer in the exam, okay, keep in mind these important points. They are, I already discussed these points once upon a time. Anyway, I brought many things. Yeah, for any question, you should write the following topics. Write down introduction. Everyone write down this one. For every answer, you must have these points. Last time, very few students are there. Anyway, still introduction, definition, or principle. For every question, these points must be there. Introduction, definition, or principle. Then, when you are elaborating the topic, try to elaborate it with flow chart. You will elaborate it with a flow chart. Then definitely we will discuss a condition in medical, in our sciences. Definitely there will be a disease. Always we are correlating it with a condition. It can be a disease. Now you need to give me a brief overview of the disease, definition of that disease or that condition, signs and symptoms. Very important, signs and symptoms of that disease. Then lab diagnosis. Lab diagnosis, I need starting from sample collection. What sample you are collecting, how you are processing the sample, then what test you are performing, test normal values, normal value of the test, then what treatment available to that condition, and last and final prophylaxis. What is the meaning of prophylaxis? Can anyone say?
Whole summary.
What is prophylaxis means?
Sir, whole summary.
No, not whole summary. Any idea what is prophylaxis means? You have parasitology, right? So you must know what is prophylaxis. Oh, very good. Prophylaxis means preventive measures. Preventive measures. What preventive measures you will take? For example, malaria. What will be the prophylaxis of malaria? No stagnated water, bleaching nearby drainage systems, right? Having mosquito net,
Sir, mosquito net.
right? Similarly, prophylaxis for COVID, no hand sanitization, PPE. Got it? Yeah. Fine. This is how I was expecting answers from you. Yes, Miss Mrs. Last point. Yes, Mrs. Yeah, the weightage depends on the type of question. 2 marks, 5 marks and 10 marks. Listen. There is a thumb rule, listen. Answer to the given question is not an answer. Listen, when I say normal values of RBC, just you write in 4.5 to 5.5 million. That's not an answer. You need to give me explanation of your answer, justification of your answer. Your answer must have a justification. Without justifying your answer, just writing, throwing an answer is not an answer. Most of the times you will do it. Alright, this is very easy. What is MCV? Mean corpuscular volume. That's it. Idiot. You give. Is that that's not the right approach. You must give me the justification of your answers. Okay? Yeah. See, I'm not saying to write everything for all the questions, but you must have that common sense of giving weightage to the question, depending on their marks. Never ever assume you are weak students. First of all, listen. You all passed 10 years of torture, +2 torture, and you are already skilled, highly skilled in maintaining that, how to write an exam. So never feel that you don't know how to write answers actually. You know it. The problem is your laziness. That's it. Yeah. Yeah. Yes. Fine. So with this, I will start weekend works. Weekend work 3.0. What is the first question? Check, students. Weekend work 1.0. Sorry, 3.0. Yes. So first one is characteristics of bleeding disorders. So what will be the answer? Characteristics of bleeding disorders. Tell me, students. Characteristics of bleeding disorder characteristics. Prolonged bleeding, then spontaneous bleeding, yes.
Bleeding through gums.
Bleeding through gums, then heavy menstrual bleeding, very good. Joint bleeding. Yes, and there is one more point. Rectal bleeding. Rectal bleeding. You know what is rectal bleeding means? When you are going for stool, okay, there is a chance of bleeding the stool. Okay. So before writing answer to this question, how you need to start it? First, you need to tell the definition of excessive bleeding. Okay, this is a condition where there will be excessive bleeding. with a minor cut can be stated as a excessive bleeding. Some characteristics are these. That's it. Second question.
Classified bleeding disorders.
Yeah, classify bleeding disorders. How we can classify? Tell me, students. Don't see the notes. Try to be generalized. Maybe clotting factor deficiency, platelet issues, or acquired conditions, or any other conditions. Clotting factor conditions. Clotting factor 8 deficiency, 9 deficiency, 11 deficiency. Then 1 milligram factor deficiency. Okay, or collagen deficiency, fibrinogen deficiency can lead to clotting diseases. Then platelet conditions, decreased platelet count, thrombocytopenia, platelet function disorders, and congenital purpura. Purpura means abnormal activation of platelets. Platelets will be activated, they will be clotted in the blood. Okay, purpura, congenital platelet problems. Purpura is a type of thrombus, correct? Thrombus, yes, same actually. Type of thrombus will be purpura. Very good. Then acquired conditions. Can you give examples of acquired bleeding conditions? Medication, maybe aspirin therapy. Then very good. Vitamin K deficiency. Vitamin K deficiency. Maybe they are not taking the proper diet, leading to vitamin K deficiency and clotting. Other conditions, maybe some cancers, leukemias. Okay, so malignancies, aplastic anemia. What is aplastic anemia? Okay, dysfunction of the bone marrow. But there won't be a cancer. In aplastic anemia, there won't be cancer. Right? So bone marrow functional activity will be reduced gradually by 40 years. Now that's it. So this is all about this question. Next question. What is the next one?
List 4 essential coagulation factors for clot formation.
Essential clotting factors. You already know the answer. You can give any 4 or 5 examples. Can you give some examples? Already you can give 8, 9, 11. Right? 8, 9, 11 hemophilia. When these clotting factors are there, hemophilia. Then?
Calcium.
Very good. Calcium. What is the significance of calcium? Calcium is the primary cofactor for each and every step of coagulation mechanism actually. Right? Each and every clotting factor will be activated in presence of calcium. So calcium, that's why removal of calcium leads to absence of clotting. Any more? Yeah, other clotting factor deficiencies. Others. Yeah, next question.
Explain the role of vitamin K in coagulation.
Very good. Vitamin K role. So see here students. Vitamin K role in coagulation. What answer you will write? Vitamin K important for 7, 9, 10 to 1. These 7, 9, 10 to 1 clotting factors are dependent on vitamin K. Vitamin K absence leads to, this factor's absence leads to excessive clotting time. Absence of clotting in the body. Sometimes we will purposefully remove vitamin K from the circulation by taking the tablets. What tablet? Warfarin. So warfarin is an oral anticoagulant. The mechanism of warfarin is to remove vitamin K. If you write these points, that will be the best answer. Next point, next question.
Hemocoagulation factor deficient in hemophilia A and B.
Yeah, what clotting factor deficient in hemophilia A and B? Clotting factor, 8, 9 and 11. You already know. In hemophilia, I need to address few more things in hemophilia. Hemophilia is a what type of genetic disorder? X-linked recessive disorder. When we say recessive, 2 recessive genes are required to get a condition. But another interesting thing, this is a X-linked since X-linked women will be affected only when they have 2 recessive genes. Males will be always affected. Right? Males will be always affected. Okay? Females will be carriers. Mostly women will be carriers, but males will be always a diseased condition. When they have one abnormal X, that's it, they will get a condition. Okay. Next question.
Identify 2 genetic causes of bleeding disorder.
Yeah. Can you give me examples? Two genetic causes of bleeding disorders. Hemophilia. Anyone? Huh? One milligram factor disorders. Anyone?
Also, glycoprotein वगैरह
Sir,
Very good. Yes, yes, Shubham. Sorry, Shubham.
Glycoprotein 1B deficiency.
1B deficiency and 2B3A deficiency. They are called as Bernard-Solé syndrome and Gallman's thrombocythemia. These four are examples for genetic causes of bleeding disorders. Clear, right? Next question.
State the common acquired cause of bleeding disorders.
Acquired causes of bleeding disorders. So acquired means first you need to give definition. What will be the definition of acquired causes of bleeding disorders? That means patients are genetically normal. Genetically they are normal, but epigenetically they got issues. Other than genetics, some external factors leading to bleeding disorders in the patient. Maybe vitamin K deficiency, dietary intake, or liver disorders. Very good. Keep in mind, vitamin K is synthesized in the liver. Okay, that means these clotting factors are liver dependent clotting factors. Okay, when there is a liver disorder, vitamin K cannot be produced, leading to issues. And another interesting thing, since we say vitamin K is diet dependent, what if patient has some GI infection, gastrointestinal infection to the patient? So there will be malabsorption. They cannot absorb the vitamin K. Even though their diet has vitamin K, they are unable to absorb, leading to bleeding condition, acquired condition. Yeah? Medication is obviously one example. Medication we can directly understand by seeing medical history of patient, like warfarin therapy or aspirin therapy. Very good. Next question.
How is hemophilia primarily inherited?
How hemophilia is inherited? You already know it's an X-linked recessive disorder. Males will be affected, females will be carrier. Unless females have two recessive genes, that you can answer directly. Next question.
List out the test performed in coagulation profile.
Yeah, list out the test performed in coagulation profile. What test we will perform in coagulation profile? Starting from VT, CT, PT, APTT, TT, TGT, INR, very good, D-dimer test, and FDPs, FDP level test, 1 milligram factor levels, platelet function test, even we can write more, fibrinogen levels, and collagen issues. Do you remember? There is a collagen issue in the body that is connected with a dietary source. Can you remember? Can you recall? Collagen is synthesized by a dietary intake. What diet? Yes. Vitamin C. Very good, Miss Kushi. Do you remember? Vitamin C will make a precursor that is a salicylic acid, and that acid is important for collagen synthesis. So vitamin C absence leads to collagen issues. There will be a bleeding disorder. That condition is called as scurvy. SCURVEY. Scurvy. Okay, scurvy is caused due to vitamin C that is linked with collagen. So you can write all these points in coagulation profile tests. Next point. Everyone take notes of this lecture. Okay, these are the answers for your exam actually. Next question.
What does prolonged bleeding time suggest?
Yes. Increased bleeding time. What does it indicate? Why bleeding time increased? Tell me, students. Yes. Why bleeding time increased? Maybe decreased platelet count. Platelets are reduced. That's why bleeding increased. Or any other things? Absence of 1 milligram factor. Genetic condition. Maybe platelets are there, but platelets receptors are deficient. Platelet function test you will have. Then
Acquired conditions.
acquired conditions. Other acquired conditions. Okay. Aspirin therapy, vitamin K is different. In bleeding, we need to focus on platelet problems. Okay. That will be the answer for this question. Next question.
Which vascular defect commonly causes bleeding disorder?
Which?
Vascular defect, vascular extinction.
Yeah. Which vascular defect will cause bleeding condition? This will be the answer, right? So Weber-Osler syndrome. Okay, Osler-Weber-Rendu syndrome will one example where there is a the blood vessel wall became thin, leading to rupture of blood vessels, leading to this condition. Next question.
Name few inhibitors that regulate the clotting cascades.
Yeah, inhibitors of clotting cascade. Yes, this I need to again revise to you.
Protein C.
Once again, students, write down the fibrinolytic mechanism, everyone. Fibrinolytic mechanism, everyone write down this flow chart. This will be the answer to that question. Okay? So, damaged blood vessel, damaged tissue. This is fibrinolytic mechanism, keep in mind. Not clotting, this is anti-clotting mechanism. When I say fibrinolytic mechanism, that means anti-clotting mechanism. Anti-clotting mechanism. Clear, right? So, damaged tissue will release thrombomodulin plus it will also release thrombin. Okay. Parallelly, it will also release lysozymes. Now, this thrombomodulin and thrombin complex will make thrombomodulin-thrombin complex. It made a complex. This complex, thrombomodulin-thrombin complex. Thrombomodulin-thrombin complex. This thrombomodulin-thrombin complex will activate protein C. So protein C will be activated. Activated protein C. Protein C got activated. This activated protein C will release two types of molecules. They will inactivate factor 5 and 8, and they will also inactivate TPA and TPA inhibitor. They will inactivate TPA inhibitor. They will inactivate the TPA inhibitor. Tissue plasminogen activator inhibitor. Tissue plasminogen activator inhibitor. TPA stands for tissue plasminogen activator inhibitor. Okay? Yeah. Now, this will lead to activation of tissue plasminogen activator. So tissue plasminogen activator activated TPA will convert plasminogen to plasmin. This plasmin will degrade the fibrin. Plasmin will degrade fibrin to two products. What are those two products? Fibrin degraded products and D-dimers. This is a fibrinolytic mechanism.
Sir, plasmin is converted to plasmin and then
This plasmin will, it will cut the fibrins. It will cut the fibrins to fibrin degraded products and D-dimers. Plasmin is the scissor molecule, right? I am always discussing. So plasmin will cut the fibrin. Clear? This is fibrinolytic mechanism. Then there are some inhibitors of fibrinolysis. We remember that this pathway should not happen during bleeding time. When there is a bleeding, this pathway should be shut down. Ideally, this pathway will be inactivated and this pathway will be activated after clot formation. After clot, this pathway will be activated. That means during hemostasis, once the platelets are started attaching to 1 milligram factor, immediately this pathway will be inhibited. Fibrinolysis will be inhibited and clotting initiated. After clot formation, this will be activated. Now, how this is inactivated? How fibrinolysis inactivated in normal condition? Yeah, there plasmin will be inactivated by two molecules. They are alpha 1, alpha 2 antiplasmin, alpha 2 antiplasmin, and alpha 2 macroglobulin. Alpha 2 macroglobulin. Alpha 2 antiplasmin and macroglobulin will inhibit the fibrinolysis. Fibrinolysis is inhibited by alpha 2 antiplasmin and macroglobulin along with this one, tissue plasminogen inhibitor. Tissue plasminogen inhibitor, alpha 2 antiplasmin and macroglobulin will inhibit the fibrinolysis. That's why during fibrinolysis we have activated it. We have inhibited this inhibitor, so it will be activated.
Sir, if inactivated or activated?
In normal see, this is an inhibitor molecule. Inhibitor molecule will be activated. See, when protein C will inhibit the inhibitor. When we are inhibiting the inhibitor, it will be activated in fibrinolytic mechanism. Whereas in normal condition, it will be inhibited. Okay. See, these are some technical things. You need to go through them. That's it. So this will be the answer to your this question. What is the question? Yeah, inhibitors that will regulate the clotting cascade. The inhibitors will be alpha 2 antiplasmin and alpha 2 macroglobulin. Okay? To write this point, you need to explain me these things. Alpha 2 antiplasmin and alpha 2 macroglobulin.
Sir, plasmin inactivate by alpha 1 and alpha 2 or activate by alpha 1?
Plasmin will be
Inactivate or activate by antiplasmin or macroglobulin.
they will inactivate the plasmin. They will inactivate the plasmin, not activate. Activation will be seen in fibrinolytic mechanism. Okay? Next point. Next question.
Differentiate between hemophilia A and B.
Oh yeah.
Everyone knows. A and B differentiate, you already know. Next question.
In detail about 1 milligram.
Yeah, discuss in detail about 1 milligram factor disease. So what you will write, what is the definition of 1 milligram factor? So this is an excessive bleeding condition that is happen due to absence of 1 milligram factor. 1 milligram factor is secreted by endothelial cells of the blood vessels. Whenever there is a damage to the blood vessel, it will release collagen. Collagen will be dumped by 1 milligram factor that is released by endothelial cells. Absence of 1 milligram factor leads to excessive bleeding, inactivation of platelets, excessive bleeding, and abnormal clotting also. There won't be clotting also. Now listen, 1 milligram factor are 3 types. This you need to write. There are 3 types of 1 milligram factors disease. 1 milligram factor disease are of 3 types. Mild, moderate and severe. 1 milligram factor disease are of 3 types. 1, 2, 3. Okay, stage 1, stage 2, stage 3. This is mild, moderate and severe. In mild, patient has 1 milligram factor but the levels are reduced. 1 milligram factor levels are reduced in mild. Whereas in moderate has 4 more categories. They are 2A, 2B, 2M, 2N. These patients will respond to treatment. They will be respond to treatment like DDAVP. DDAVP stands for desmopressin. Desmopressin is the treatment for 1 milligram factor. Where I wrote, yeah, desmopressin, right? So, but in case of severe condition, they must get 1 milligram factor transplantation. We will take a healthy individual, we will extract the 1 milligram factor and we will transfuse 1 milligram factor to severe condition. That means they won't even respond to medication. Their body cannot generate 1 milligram factor upon stimulation. Very severe. If you can't understand hemophilia and 1 milligram factor, during they are doing their tongue cleaning, they will get excessive bleeding from their tongue, maybe half liter from tongue. See, because they can't stop bleeding. They have bleeding issue, right? So once bleeding initiated, that's it. The blood will keep on bleeding.
While we are doing the tongue cleaning, there is no.
See, there are minute capillaries on the tongue. In us, normal individuals, the clotting happening and we don't have excessive bleeding. Even for us, no, if you do very tough, hard then you will get blood. But for them, it will be very severe. Or I will say one more thing. When they are brushing, their brush bristles, they can damage the gums and they will have heavy bleeding from gums during brushing. Hemophilia patients. Excessive gum bleeding can be seen among hemophilia and 1 milligram factor. Alright, next question. Severe condition. Yeah, in severe condition we need to give transplantation of 1 milligram factor. That's it, no more other treatment. Next question.
These causes of acquired platelet function disorder.
Acquired platelet function.
Yeah, acquired platelet function disorder causes. What causes leads to acquired platelet disorders? Tell me, students. Aspirin. Then drug, dietary, then
Blood transfusions.
blood transfusions. Okay. Frequent blood transfusions. There will be hemolysis along with platelet count will be reduced. Frequent blood transfusions. Dialysis patients among blood dialysis. That means frequent blood transfusions. Alcohol consumption. Yeah, that is there always. Well, that is CR meeting. Okay, you can. You and who is that? Oh, you both can go at 12:30, not now. Very good. Any more? Acquired conditions. Check in the notes. Vitamin K. Vitamin K with platelets. Is it possible to connect vitamin K with platelet problems? Vitamin K is about clotting factors. Vitamin K is clotting factor dependent, not platelets. Vitamin B12. Vitamin B12 can be there because B12 will synthesize the blood. Hemopoiesis can be done by vitamin B12 deficiency. So vitamin B12 deficiency, acquired condition of platelet problems. Any more?
Cardiopulmonary bypass surgery.
Yeah, in bypass surgeries, obviously. Yeah. Consumption of drugs. That's it. I think we covered all the aspects of this question. Next question.
Outline the three main stages of the coagulation mechanism.
Three main stages of coagulation mechanism. I hope you already know. Intrinsic, extrinsic and common. This pathway you will explain in detail, right? So that's it. That you already know. Coagulation mechanism, simple question. Next question.
What comprehensive analysis is provided by coagulation profile test?
Yeah, analysis of coagulation profile. Again, you will discuss all these tests, okay? Coagulation profile, PT, APTT, TT, TGT, the other tests. 1 milligram factor assays, fibrinogen level test, okay? Next question, that already knows.
What answer?
We can work it complete.
Then we can work 4. Go to we can work 4.
What does an extent APTT indicate?
Very good. Increased APTT, what does it indicate? Increased APTT, what does it indicate?
Intrinsic pathway or pathology.
Intrinsic, see, intrinsic is okay. Intrinsic pathway disorders. Examples: hemophilia A, B, C. Then elevated APTT. What else it will discuss? Can we detect 1 milligram factor disease by APTT levels? Can we detect 1 milligram factor disease by elevated APTT levels? Think, students. How? What? What vitamin? Clotting factor 8 is linked with 1 milligram factor always. So that's it. So APTT will be elevated in 1 milligram factor disease also. Got my point? 1 milligram factor is dependent with vitamin cardiovascular rate. Okay. Yeah. Fine. Next question.
What is Bernard
Oh, Bernard-Solé syndrome. Very good. What is Bernard-Solé syndrome? Tell me, students. Deficiency of GP1B, right? GP1B glycoprotein. That is, absence of this protein leads to absence of attachment of platelets. Absence of attachment of platelets leads to increased bleeding time. So that is the Bernard-Solé syndrome. Next question. Huh? Absence of GP1B leads to absence of attachment. Absence of attachment leads to increased bleeding time. That is what I said. Next question.
What does a clot retraction test assess?
Yeah, very good. What is clot retraction test? We studied it. Can anyone tell me, students? What is the significance of clot retraction test? What is clot retraction test? Can you tell me? So we took a blood sample, okay? Platelet poor plasma plus platelet rich plasma, okay? Then we took platelets. So what we did, we took we took whole blood. We took whole blood. In this whole blood, we already citrated blood. Citrated blood will remove clotting factors from the blood. Then what we did, in this I added ristocitin. Ristocitin will activate the platelets. Now activated platelets will start clotting in the tube. So I will wait for almost 8 hours, 6 to 8 hours. After 6 to 8 hours,
30 minutes.
30 minutes, yes, 30 minutes. In your given example, I given 30 minutes as a standard time. Okay. After half an hour, I will see the clot retraction. The red blood cells, everything will be clumped in the test tube. This test will be very good to assess hemostasis mechanism. It will give two insights of the process. One is rigidity, platelets clot rigidity plus one more I discussed. Clot rigidity and clot elasticity. Elasticity will be rigidity. One more I discussed. Open that notes. Clot retraction will determine two things. Shear stress. Very good. What is shear stress? Shear stress. What is shear stress? Shear stress is the pressure exerted by flowing blood. When the blood is under flow, it will exert a pressure on the blood vessels. During this pressure, whether the platelets can able to hold the blood or not, it can prevent bleeding or not. Biopsy.
Physics, biopsy.
Biopsy. A sort of, we can say. Yeah, negative biopsy will be accepted. Negative biopsy is a shear test. Biopsy, that is correct. Yeah. Shear pressure test. Okay. Next question.
What is Gall's from
Gall's thrombus theory, already you know. 2B3A deficiency. 2B3A deficiency, absence of aggregation of platelets, absence of primary platelet plug, increased bleeding time. Next question.
Describe the main symptom of idiopathic thrombocytopenic purpura.
Yeah, idiopathic thrombocytopenia. What is the meaning of idiopathic thrombocytopenia? Unknown reasons. Some unknown external reasons leading to decreased platelet count. So what are the reasons? See the notes, students. Oh, this. What is the question again? Repeat it. Symptoms of. Okay, it's not about factors. So symptoms of thrombocytopenia. Again, same bleeding conditions only. You will write symptoms of bleeding. That's it. Increased menstrual bleeding. Easy bursting, all these things. Bursting means, what is the meaning of bursting? Discoloration of the skin, okay, reddish patches or reddish brown patches on the skin is called a buzzing, skin buzzes. Next question.
How is platelet adhesion measured in the laboratory?
Yeah, platelet adhesion test. For platelet adhesion test, actually, I have sent you a review paper of platelet function test. In platelet function test, there is a, last time I given you a notes, PF100 test, then cone plate assay, then HAI test, hemostasis assay test, HAI test. I discussed in the last lecture. I know I didn't do 2 lectures. Previously I discussed. Just go through that notes, okay, once. Platelet function test review paper. Just go through the notes of that review paper. There you will understand. Next question.
What does abnormal platelet aggregation indicates?
Yeah, what does abnormal platelet aggregation indicates? Yeah, tell me students. There is an abnormal platelet aggregation that indicates might be they are releasing excessive thromboxane A2. So see the reasons. What is the notes? What does the note states?
Platelet dysfunction,
Medications,
systemic disorder,
systemic disorders, genetic factors. Do I given further notes to it? What genetic factors?
indicate disorder affecting platelet function such as storage pool disease can lead to the abnormal aggregation.
Yeah, this I didn't cover this topic. Okay, there is something on platelet pool disease, right? Sometimes students in the body, listen, thromboxane A2 is released by platelets. Thromboxane A2 is also present on some infectious bacteria. Some bacterial cell wall has thromboxane A2, similar thromboxane A2 residues called cephalins. Cephalins, okay? When we got exposed to some infections, these infections will trigger aggregation of platelets. Aggregated platelets will be activated and they will cause these complications. Okay, such condition is called as platelet pool disease. Some infections will cause platelets to aggregate in the body. Okay, Ebola is one example. In Ebola, what happens is, when you got Ebola virus infection, the blood will clot. Because Ebola virus has activators that can activate platelets. And platelets will clot in the body. Or I will give you one symptom of Ebola. Patients will bleed from the eyes. Okay, when you have Ebola viral infection, within 2 to 3 days you will start bleeding from the eyes. Thank God COVID is not a such virus. You imagine Ebola is a pandemic. It will be like we are all zombies. Anyway, next question.
What does an increased PCI suggest in clotting disorder?
What does increased
PCI.
PCI?
Yes.
PCI. Okay, prothrombin type index. Okay, yeah, prothrombin clotting index. That is same as PT and INR actually. We will take INR values and PT values and we will integrate. We will get the value. Okay, there is a small calculation. You can go through it. Next question.
How does PT relate to extrinsic pathway efficiency?
You already know how PT related to extrinsic because we already know extrinsic will be detected by prothrombin type. Prothrombin is a part of extrinsic. That's it. Actually, PT and APTT is sufficient to understand clotting issues in the body. TT and TGT will be further investigations when we can't understand these two. Okay, our next question.
Sir, what condition can prolong thrombin time?
What condition will prolong prothrombin time? You already know. What condition will increase the prolonged prothrombin time? Prothrombin time, not APTT. APTT hemophilia. Yeah. What are the conditions? See the answers.
Heparin therapy.
Heparin therapy,
Fibrinogen deficiency.
fibrinogen deficiency, dysfibrinogenemia. That means by default their fibrinogen levels are less in the blood. Liver diseases. Okay. 99% of proteins in the body are produced by liver. Plasma proteins by liver. Okay. So whenever there is a liver issue, there will be issues with all these things. Very good. Next question.
What does the TT and TGT is assessed in college?
TT and TGT. Yeah, thrombin time and thrombin generation test. Thrombin generation test overall efficiency of clot formation, and TT will be detect the conversion of thrombin to thrombin, right? Prothrombin to thrombin. Yeah, next question.
Which clotting factor deficiency is diagnosed by PT and APT?
Everyone already knows. PT, APTT, clotting factor deficiencies. Next.
Explain in detail about hemostasis process with a flow factor.
Yeah, in detail about hemostasis, you already know. Every time you are writing it. Next question.
Which test
What you
evaluates
want? You can go out. Both you can discuss outside. Yes. What is next question?
which test evaluates the intrinsic coagulation pathway?
Yeah. If there are intrinsic pathway issues, what test you will have? APTT. You already know the answer. Next question.
Which lab test is first line for diagnosing bleeding disorders?
Yeah. What are the first line of BTCT? Then you will go for PTT. CBC, platelet count, BT and CT. These are the four first line of tests. Okay. CBC, platelet count, bleeding time and clotting time. Next.
What does PF3 ability indicates in hemostasis?
Yeah. Last time I added this point, right? In the
Platelet factor.
yeah, platelet factor 3. Wait. Platelet factor 3. Here I wrote. See students, I didn't discuss this previously, but I added it later. Where I wrote it? Platelet factor 3. Yeah. So platelet factor 3 is also one of the important cytokines released by platelets during hemostasis. We are always discussing thromboxane, serotonin, ADP, right? Along with ADP, they will also secrete a cytokine called platelet factor 3. Okay, absence of platelet factor 3 will have similar symptoms like thromboxane deficiency. Okay, platelet aggregation issues. So platelet factor 3 is also important cytokine. It will be involved in both clotting and bleeding condition. Next question.
What platelet effect leads to impaired clot formation?
What platelet disorder defect leads to impaired clot formation? Definitely 1B, 2B deficiencies and thromboxane A2 release. Okay, these are interlinked. See the answer once. Same, right? Carl's and Bernard-Solé syndrome. Next question.
How do platelet function tests diagnose disorders?
Yeah, PFT has various tests and they will see all the issues of platelet function test, right? Disorders. Galvez thrombocythemia, Bernard-Solé and other disorders. Already known. Next question. Go to the last and final. Fifth one. We can work 5.
What triggers hyperfibrinolysis in the body?
What triggers hyperfibrinolysis in the body? Yeah, you try to understand, students. See the notes, what I stated there. What are the triggers of hyperfibrinolysis?
Severe trauma, liver diseases, certain cancers, neurological disorders, medications, and
Pregnancy.
आप इसको explain किया.
Surgeries. Can you able to go through that notes once? Or do I need to explain anything in that? You already understand, right? What triggers hyperfibrinolysis?
Sir, explain करना पड़ेगा हमसे. यहाँ सिर्फ the points will be enough होगा.
Yeah, listen. When there will be excessive fibrinolysis, when there is excessive clotting. Excessive clotting can also be seen during surgeries. We are cutting the tissues, so cutted tissues, they need to be clotted again. So post-surgery there will be excessive fibrinolysis. So what conditions lead into surgeries? Maybe pregnancy, post-mortem, that means delivery time, post-delivery. During this time we will see C-sections, all these related answers will be there. Next question.
How would you define the thrombus?
Yeah, definition of thrombus. Blockage, okay, clotting of blood within a blood vessel is called as thrombus. This thrombus will block the blood vessels, leading to ischemia, blockage of blood supply, leading to deprivation of oxygen to the tissue death. Then deep vein thrombosis, I guess. Next question. What is the next question?
So list the major factor for the venous thrombosis.
Yeah, factors of venous thrombosis. Here you have the answers. Infections,
Surgery.
surgeries. See, what are the other conditions?
Pregnancy.
Cancers. Always cancers will be there because they will block the vessels, okay, with abnormal cells. Inflammatory disorders. This you can go through with. Next question.
How hormonal changes?
What does a positive D-dimer test indicate?
How hormonal change leads to clot formation?
How hormonal?
Change.
Yeah. First of all, what hormones contribute to hemopoiesis? Tell me, students. What hormones required for hemopoiesis, not stasis? What hormones are required for hemopoiesis? Tell me. Erythropoietin. Yes, you can leave. You and Muskan can leave. Yeah, erythropoietin, right? When there is a hormonal disbalance, especially erythropoietin, that will disturb the entire hemopoietic activity. That will disturb even synthesis of platelets. So definitely it will affect the bleeding conditions. Platelets will be affected by, platelet count will be reduced in absence of or reduced erythropoietin. Reduced erythropoietin, reduced platelet count, increased bleeding. How hormonal? Question is how hormonal changes leads to bleeding. One will be erythropoietin. Next.
Why pregnant women are at high risk of clotting?
Why pregnant women are high risk of excessive
Clot formation.
No, I understood. See, among pregnant women, there are two problems. One will be there. Obviously, pregnant women will be in anemic condition. That's why we will give severe, supplementations. Why they are in anemia? Because they are giving supply to other baby. See, baby won't help mother at all. It is mother's business to sustain two lives. That's why I used to tell babies are always parasites. They won't help mother at all. They will only take nutrients from the mother, but they won't give any return to the mothers. That leads to deficiency of everything in the mother. Even clotting factors, even proteins will be deficient in the mother. When the nutrition is deficient in the mother's liver cannot produce sufficient proteins, leading to clotting factor deficiencies, leading to clotting problems in the mother. It is due to nutrition deficiency in the mother. Who is taking those nutritions? Nutritions are hijacked by parasite. That is the developing baby actually. Baby is a parasite actually, biologically speaking. Exactly. Yeah. Babies are so parasitic. I will tell some reasons. Listen. Babies are so selfish. Yeah, listen. Embryos are so selfish. Listen. A developing baby is so selfish. Baby needs glucose for its energy. But what mother will do? Mother will utilize her glucose for her tissues. So what baby will do? Baby will release some inhibitors into the mother circulation. Baby will release insulin inhibitors. Baby releasing some inhibitors to insulin. So mother insulin cannot work. So mother's glucose will be increased. The glucose-rich blood will be taken to the fetus. Fetus will enjoy the glucose. Okay? That's why a mother is prone to gestational diabetes. Do you know what is gestational diabetes? During pregnancy, mother will get sugar. The reason is the baby elevating mother's sugar levels. Because baby requires the sugar for its growth. See? Babies are not good in one way. They are parasites. Um, yes. And another interesting thing, I saw that is really interesting. I'll discuss this topic later. Okay, very interesting. Parasitism of baby, pregnancy parasitism.
Hormone therapy lead to clot formation.
Hormonal therapy lead to clot formation.
How?
For that I need to go through the materials. That I need to check. What hormonal therapy they are undergoing, how they are related.
Like birth control pills or change hormone change.
Estrogen and progesterone, corticosteroids. When you are saying corticosteroids, obviously corticosteroids will cause clotting. Listen, corticosteroids will destroy the blood cells. Corticosteroids have a bad effect on red blood, blood cells. When I say blood cells, including platelets, WBCs. Corticosteroids will destroy the WBCs and platelets. So, I don't know how that will increase clotting. That should decrease the clotting. There might be some negative loop. I need to check in the textbooks. I don't know the negative loop mechanism of that hormonal therapy. But obviously, corticosteroids, estrogen, progesterone, corticosteroids can affect the immune cells. Immune cells will be deprived in the presence of corticosteroids. I mean. That I will see and I will let you know. Endocrinology I need to study again. I need to check the loops, mechanisms, feedbacks. Yes, now George.
Sir, what reason causes hormone imbalance?
Huh?
What reason causes hormone imbalance?
What reason causes hormonal imbalance? There are plethora of reasons that is beyond this subject. You see later. Epigenetic factors, lifestyle, diet, and some triggers in the body, pregnancy status. Yeah, that we'll discuss later. Yes, both cousins. What? Clot retraction is best for understanding the overall hemostasis mechanism. Overall hemostasis mechanism can be understood by clot retraction test. Next question.
What does a positive D-dimer test indicate?
Yeah, positive D-dimer test. When D-dimers are more in the body, I discussed here. When there is an excessive D-dimers, that indicates there is an excessive fibrinolytic mechanism. Excessive fibrinolytic due to excessive clotting in the body. So that's it. That is the answer to this question. Positive D-dimer signifies excessive clotting in the body. DIC. It might signify a DIC. It might be, I cannot say DIC, it might be a condition of excessive positive D-dimer. Yeah, exactly. Thrombus. DVT. Thrombus will be best answer. Thrombus has all the things. DVT, purpura, DIC, everything. Next question.
How is fibrinolytic activity in the human lab?
Yeah, how fibrinolysis will be measured. You will measure all these products, okay? PT, APDT, TT, TGT. See, yes, you didn't already went. Okay, next.
What role does plasmin play in fibrinolysis?
What is the role of plasmin in fibrinolysis? You already know plasmin is the major fibrinolytic protein. So there you need to write a flowchart. Okay, fibrinolytic mechanism flowchart. Next. Yeah. This is the final test. If patient is in warfarin therapy, listen. Patient is under warfarin therapy. How you will assess? What lab test you will opt for understanding warfarin therapy? Yeah. What lab test you will opt to understand the warfarin therapy patient?
Vitamin K.
You will check vitamin K levels, that is a biochemistry test. Yeah, very good. Prothrombin time. First you will perform clotting time. Clotting time will be increased in warfarin therapy. Parallelly you will check the levels of, the values of this one, PT. PT will be elevated in warfarin therapy because PT discussing about extrinsic. Vitamin K is extrinsic pathway. So PT can be performed. Then clotting time, vitamin K levels will be assessed, Any more? Yeah, these are the primary tests. So similarly, we will check other clotting therapies. Heparin will be checked by APTT. Heparin is in the intrinsic pathway. Okay, heparin will be assessed by APTT levels. Any more? That's it, student. This is all about unit 2. Okay. Yeah. Right. Thank you very much. Very big class.